Chapter 9, Cultural Awareness. So each of us, whether we believe it or not, has some type of bias that is culturally driven. Some biases can be referred to as an unconscious or an implicit bias. Culturally congruent care or transcultural care, it emphasizes the need to provide care based on an individual's culture, their beliefs, practices, and values. So, effective communication is a critical skill in culturally competent care. Effective communication also helps the nurse engage with the patient and family in a very respectful and patient-centered manner. Cultural competence to nursing means that we provide care that is culturally sensitive, appropriate, and competent to meet the various healthcare needs of our patient, whether it's a single individual or a community. So both historical and social realities, they actually shape the way we think or our worldview. The worldview determines how people look at others, how they interact and relate to the reality, and how individuals process information. An actual worldview is a set of assumptions that begins to develop during an individual's childhood, and it therefore guides how an individual sees, how they think about, how they experience, and how they interpret their world around them. It creates a lens through which everyone views all of their life experiences through their own unique tinted view. Worldview evolves during a lifetime of process of interacting with other individuals, different organizations, and institutions. It is vital for you as a nurse to advocate for patients based on their cultural worldviews. So health disparities, when we're talking about individuals and things that are detriments from health and wellness, we consider poor health status, we look at disease risk factors, poor health goals or outcomes, the limited access that individuals have to care. These are often interrelated and influenced by the conditions and where people live. Intersectionality. This is actually a research and a policy model that helps to study individuals' lives and their experiences. This model looks at how being marginalized or having health disparities will affect people's health and access. So they're talking about individuals that, depending on where they live. This looks at describing forces, factors, and some of the power structures that shape and influence life in general. This intersectionality is just a way to understand and analyze the complex world by looking at the actual experience of human beings. Each level of this ladder of cultural competence, it offers a response to the ladder of oppression. Because of extensiveness and complexity of the different systems of oppression, individuals and organizations will move up and down both ladders at the same time. Racial identity is actually based on your self-identification with one or more of the social groups that has a common heritage and with whatever racial group is shared. Ethnic and cultural identity is actually considered the framework in which individuals identify consciously or unconsciously, and with those who they feel they have a common bond because of similarities, whether it's traditions, behaviors, beliefs. Acculturation actually occurs whenever an individual will transition from one culture and then develops traits of another culture. During this time, there's going to be an adaptation to the new culture customs, and maybe even language. Assimilation, this is the process where the individual actually adapts to their host's cultural values, and they will actually no longer prefer their culture word that they originally had. So our culture actually influences our thoughts regarding the way people define disease and illness. As a nurse, you need to understand the difference between disease and illness so that you can pursue ongoing cultural competence while you're providing your patient care. So illness is the way in which individuals and families choose to react to disease, whereas disease is an actual malfunctioning of a biologic or a psychologic process. While you're reading this case study, think about this question. How would you assist Mrs. Tao? So core measures, these are a set of both evidence-based and scientifically researched standards of care. Core measures for us as nurses are key quality indicators that are used to help healthcare institutions improve their overall performance, increase the accountability, and they assist with reducing healthcare costs. And these specific core measures are for every person throughout the institution. These core measures, they need to be meaningful, right, to our patients. And they also, we want to ensure that these core measures reduce the variability in the outcome measure selection, the financial cost burden, and we just provide our patients with the best care using the core measures. So cultural awareness is actually the process of looking at one's own biases toward other cultures and exploring the in-depth cultural thought and professional background that one has. The knowledge for culture is the process where a nurse seeks and obtains a sound educational base related to different cultures. Cultural skill is actually the ability to conduct a good cultural assessment and to collect appropriate data about the patient's belief in their problem as well as an assessment physically. A cultural encounter, this is a process that actually encourages nurses to directly engage in face-to-face cultural interactions with people from culturally diverse backgrounds. Cultural desire is considered the motivation of the nurse to want to, and not feel like they have to, engage in becoming culturally aware, culturally knowledgeable, and culturally competent. Healthcare disparities are unequal burdens of disease morbidity and mortality rates that is experienced by racial and ethnic groups. These disparities are often exacerbated, or the word means increased by, the answer is D. It is all of them. So cultural awareness, it requires a nurse to do a self-examination of their own biases toward other cultures. A self-examination will help each of us understand our own worldview of how we perceive patients and how we engage with those patients. Before we begin to assess other cultures and races, as well as ethnicities, we want to make sure that we first understand our own culture, our racial and ethnic heritage, as well as our beliefs and values within our own culture. So storytelling conveys culture. It combines one's personal experience with commonalities throughout of all personal experiences. When you encourage your patient to tell you a story, you frame important messages in ways that make them memorable for both you and your patient. So telling a story often will engage the nurse and a patient in a way that helps increase their relational understanding. Related to the worldview, this is a thought that most of the iceberg is underneath the surface of the water, and that most aspects of an individual's worldview lie outside their awareness and they're invisible to everyone that's around them. Collecting a culturally based nursing history, performing culturally based physical assessment, and using teachback with plain English, plain language, are cultural skills that take a nurse's practice and requires the nurse to apply their own awareness and knowledge of culture. So when you're looking at linguistic competency, this is the ability to communicate effectively as well as convey information that is easily understood by various individuals. Health literacy is the degree to which individuals have an actual capacity to obtain, process, as well as understand basic health information, as well as the services needed for them to make appropriate decisions. When performing a physical assessment, you want to gather knowledge about a patient and it directs your actual hands-on assessment. It is vital for a good delivery of the quality and safe healthcare. But most patients often experience a lot of challenges when they're trying to communicate with us. Studies have shown that 40 to 80% of the information that we provide to patients during office visits is immediately forgotten, and that about half of that information that is remembered is not correct. So in every healthcare setting, the nurse is going to obviously interact with patients from other backgrounds. This interaction is a cultural encounter, and it has actually two goals. The first goal is to communicate in a way that generates a huge variety of responses and to send and receive both verbal and nonverbal communication accurately and appropriately with each different culture. Our second goal is to continuously interact with patients from different backgrounds to help us validate, refine, or modify the existing values and beliefs as well as practices about a cultural group. Cultural desire does refer to having motivation to engage with patients in a way that helps you understand them from their cultural perspective. This is extremely important when you're trying to gain cultural competence. After reading the last two slides, so what, as a nurse, what are your thoughts and impressions? Do you think the patient will drink the ice water as, Jenny expects? Why may the patient not follow the suggestion that is made to drink the ice water? So after reading this, did you happen to maybe expect that this might be the situation related to culture and the way they view illness and how they handle illness? After reading this, think about are the questions open-ended questions? You know, what information is important that we're going to form very focused or specific questions? So it is vital when reading this that you understand, as nurses, we have to follow through with our communicating specific culture-related information to everyone that is providing care for the patient. So what teaching strategies and evaluation strategies are used or would be useful here for this patient? You are in the process of admitting an ethnically diverse patient. To plan culturally competent care, as a nurse, you will conduct a cultural assessment that includes what? The answer is B, ethnohistory.